Hey everybody, this is Dr. Jay Collingsworth. I'm the founder or co-founder of Pacific Psych Centers, and I'm going to start doing videos for the website. And I'd like to just keep this as a forum that we could have an ongoing discussion about some of the things that we're doing in the clinic and some of the things that are happening in the world with regards to, treatment of mental health. And there's some exciting things that are going on in the world. Um, we do at our clinic, we do ketamine treatments, we do intramuscular, we do IV, we do some traditional psychiatric treatments, medication management, psychotherapy, and we also do TMS, which is an FDA approved treatment. But in the near future, there's going to be likely some other medicines that are available to us. And what I'm talking about are the psychedelic medications. Probably first will be MDMA and psilocybin will follow potentially, but everything's up in the air at this point. There's clinical trials being done in both of those medicines right now. Um, I'm currently in a training program for psychedelic therapy and research at the CIIS. It's the California Institute of Integral Studies, and I'm about halfway through that program, I would say. And it's been great. Like, it's been one of the coolest trainings that I've ever done. And we are just getting way into the weeds of using these substances for mental health. It's been awesome. Most recently, we've had a lot of training on MDMA therapy, which has been really cool. We've witnessed a lot of recorded sessions with MDMA. We've talked to some of the instructors and mentors that are available to us at CIS have been just amazing. These are like legends in that space, in that psychedelic space, people that have been doing trials for 30, 40 years, and a lot of things that I really didn't expect to learn in that course, but it's been really cool. And I want to be able to like answer questions. I want to be able to bring people on and like maybe have interviews or discussions with them. I think this is like basically video number one, and I don't know what I'm doing with YouTube at all. But I'm thinking comments will be available for people to put questions on what to do with the next video, which I hope to make like on a maybe a weekly basis, maybe every other week or something like that. We'll just have to see how it unfolds. But I'm willing to talk about anything, like what we do at the clinic, what we like to do at the clinic, some of the ideas that we have, some of the things that I'm learning about with at CIIS with the psychedelics, with MDMA and psilocybin. Um, I want to make it like an open forum, kind of like a discussion. I want it to be useful to people. I like having a place where I can just talk to. I don't want to make it very formal where I have to do a presentation, where I have to prepare for it, where I have to do all this stuff. I just want to be able to answer questions directly. Like I can only answer certain things. I can't really give medical advice, obviously. So if you're asking a specific question about what you want for yourself or somebody else, we can talk about it in general terms, but we just can't. Um, I can't give medical advice. I have to be careful about what I say with psychedelics for legal reasons. I don't know what the actual consequences are, but I'm learning something that's very unique and special and really sacred for that matter. And it's in good faith that I can talk about what I'm learning. I'm not going to talk about. I have to be careful what I talk about because I have an active medical license and I have a practice and I don't want to jeopardize that. But I also want to be informative to people because psychedelics are getting a lot of attention and a lot of people don't know where to go to for information on that. But with the CIAS program, I'm learning a lot and I feel very comfortable with the information that's being passed on to me as very credible and reliable. And I just want to be able to kind of pass some of that along to people, through this forum. So if you have comments or questions, things you want to talk about, put them in the comments. I think you can subscribe to the channel. We may not get very much of an audience at first, but I'm imagining that this is going to be a pretty a pretty hot topic. I mean, our clinic gets calls for psychedelic treatment every single day. Like at least a few people call and say, when can I get this? When can I get that? I don't know if you would consider ketamine a psychedelic. Some people would, some people won't. But I can tell you that we do provide ketamine treatments at our clinic. We do a lot of them. We've been doing it for 5 years. We do intramuscular, we do IV. We have a good thing at our clinic using that. It's not a perfect medication. There are no perfect medications, but it's pretty good. And I think the way that we do it has been very helpful for a lot of people. Some people, don't benefit from it, but it's been a really cool last 5 years. And the next 5 years is going to be probably even cooler with being able to offer certain things that as they become available, whether it's decriminalization, legalization, FDA rescheduling. But my vision, just to kind of give a little insight into what I envision for the clinic I want to be a reliable place for people to go to get these treatments. Whether it's MDMA, ketamine, psilocybin eventually. I know that people are going to want to go somewhere where they trust, to a trusted source, and I want to be that trusted source. I mean, that's why I'm doing all this education and training that I don't need to do. I could just, keep doing what I'm doing, but I'm not going to learn it the way that I can from these just amazing instructors and through this amazing program at CIIS. So that's my vision for the clinic, is just to be able to integrate all these things in and offer them to people that are suffering and that are looking for healing journeys of some kind, whether it's a treatment of a mental health condition or just a healing journey for some type of trauma, or they're looking to better their lives in some other way. So that's basically the intention of this channel and this video. I'll try to make it as good as I can. If it just falls flat and there's no real interest, then we'll see what happens. But I'm going to post this on the Facebook page of the clinic, and soon I'll post it on the website, on our clinic's website at pacificpsychcenters.com, and it'll be a place where you can kind of go to look at the video again. But I'll keep them short, in the beginning. I think it's at 7 minutes right now. It won't be long video, but maybe, we'll see how it changes over time. I would like to get some people. I have access to a lot of really interesting people, and if they're willing to come on and do some talks or some kind of interviews, that would be amazing. But like I just listened to Joe Rogan's podcast over the weekend. I had to go on a long drive, so it was a 3-hour interview with Rick Doblin, who's the founder and the executive director of MAPS, who's basically funded the FDA approval process for MDMA. And it was a really just amazing, awesome interview with so much information. Plus Joe Rogan's great. He's he's an interesting guy. He has interesting opinions, and he's super funny. So he had a good spin on it too. But it was a really great back and forth between the two of them. So if you're interested in MDMA specifically, I would check that out. It's Joe Rogan's podcast, and Rick Doblin is the founder of MAPS, and I found it on Spotify, so it's easy to find. Anyways, I'm gonna sign up. Just leave some comments. You can subscribe or like, I guess, and we'll see how this changes over time. So anyways, take care.